Ladies and gentlemen, it's back. I don't know how you have survived the suspense, but it is time for the Recovery Room's binge episode number 2. Our binge episodes highlight the key points of our last 25 or so videos, packed with positive, easy to understand, medically accurate information for cancer patients and survivors to use to make their life stronger and healthier. I'm Dr. Leslie Waltke, cancer physical therapist and founder of the Waltke Cancer Rehabilitation Academy and the Recovery Room. It is binge number 2 time. Fasten your seatbelts. Here we go. In the last 25 or so videos, we have learned that taking naps is awesome. Duh. But if you are in cancer treatment, recently finished, or are still fatigued, you should only nap if you are sleeping through the night and exercising regularly. We have learned that if you are physically unable or find it difficult to stand on one leg with your eyes closed or to get up from the floor without using the assistance of your hands, it is a dire warning sign that you are losing the strength, flexibility, and balance required to maintain your independence, and you may be aging faster than you should be. Yes, this is reversible. Get in to see a physical therapist right away. We have learned that in the life of a cancer patient or survivor, expecting yourself to be positive 100% of the time is both unrealistic and unnecessary. Occasional screaming and venting can actually help you cope better with cancer-related stressors. We have learned that being cold and wet cannot make you sick. Only a cold virus can make you sick. To avoid catching a cold from someone around you, you need to be at least 6 feet away. And speaking of sick, the common cold virus and the influenza virus are two very different viruses. A cold is annoying, the flu is dangerous, and kills tens of thousands of people in the United States every year. The annual flu shot is a safe and effective way to drastically reduce your risk of getting the flu and from dying from the flu, so please get one. Hand washing is one of the world's greatest defenses against viruses, bacteria, and getting sick. For hand washing to be most effective, you must wash for at least 20 seconds and follow basic sterile procedure. And speaking of personal hygiene, we all hopped into the shower to learn that deodorants and antiperspirants do not cause cancer and are safe to use during radiation. We all know that October is National Breast Cancer Awareness Month, but there are hundreds of types of cancers, and we all need national attention on all of them. We, the consumer, need also to make sure that our dollars we donate and spend are ethically, efficiently, responsibly, and transparently used. We've learned that because of good things like declining cancer death rates, increasing 5-year cancer survival, all of us getting older and living longer is skyrocketing the prevalence of cancer across our beautiful planet, and we need to be better prepared. We've learned a bunch about cancer treatments, like the different kinds of mastectomies, and that the first one was done in the United States in 1882. We've learned you may need radiation after a partial mastectomy, even with clean margins, because the radiation kills any unforeseen microscopic cells left behind and decreases the risk of a local recurrence years down the road. We have learned that the sentinel lymph node is the first lymph node in the chain in the area around the tumor. Using a blue dye and a radioactive isotope during the sentinel lymph node biopsy helps the surgeon remove and identify the first 2 or 3 nodes and then potentially avoid removing more lymph nodes. This reduces the risk of lymphedema. We have learned that after cancer surgery and radiation, because scar tissue and radiation fibrosis can slowly tighten over a year or so, you may need to stretch for up to a year to a year and a half to finally get rid of all the tightness. We've learned that chemotherapy-induced myelosuppression is the fancy way to say decreased blood counts from chemotherapy, and that Neulasta is a drug that stimulates the bone marrow to increase the production of infection-fighting white blood cells. Neulasta can make your bones ache like crazy, but rest assured it is not causing any damage and will completely go away in a couple of days. If the pain is bad, talk to your doctor or nurse about how to help you with medication. We've learned the terminology for the different kinds of systemic therapy cancer drugs, including biological therapies, hormonal therapies, immunotherapies, and targeted therapies. We've learned that these cancer therapies, some are less toxic than others, but all of them can have significant cardiopulmonary and physical side effects that can affect daily functioning. Speaking of physical functioning, we have learned some really cool exercises that you can do outdoors or in the comfort of your own home. These exercises will help you maintain a healthy body weight, reduce fatigue, improve your strength, coordination, and mobility, and can even impact the quality and length of your life and may even decrease the risk of cancer recurrence. Exercise is medicine. So check out our videos to learn these easy and free to do balance and strength exercises. It is never too late to change your life and strengthen your life. And we have learned that I don't think and speak well after hanging upside down for too long, have an aversion to large needles, I have pretty awesome looking gluteals, can change my clothes really fast, and that I look absolutely spectacular in my bathrobe. We have learned that you should care for and honor yourself like you are the most important person on this planet, because you are. And that you should exercise like your life depends on it, because it does. And I hope that you have learned that the Recovery Room is really, really cool. So please share, comment, like, follow, and subscribe on YouTube and Facebook, as it really helps us to continue to reach more cancer patients and survivors, as well as the people that love them. Happy binging number 2. Let's talk again soon.